Greetings. My name is Professor Kihara Anne-Beatrice, the president of FIGO. Wow, I'm really excited today to have met up with Professor Jacqueline Dunkley-Bent, the chief midwife at the International Confederation of Midwives. Jackie, how are you this morning?
Oh, I'm absolutely delighted to be standing side by side with you as the president of FIGO to address and discuss a really, really significant subject. I'm just glad to be here.
Thank you so much. Now, ladies and gentlemen, as we go through our cup of coffee with Jacqueline, we really want to celebrate our valued partnership between FIGO and ICM, which is moving from strength to strength, and really bring out for you why this collaboration is extremely important to us. We know that we have, particularly at this time, staticness or even upward ascent of maternal and neonatal mortality, and we really want to tackle that elephant. Beyond that, we know postpartum hemorrhage is still the major cause of maternal mortality. And with Jackie, I think we really want to work through making you understand why this relationship, particularly for all healthcare professionals, is a significant milestone towards tackling Sustainable Development Goal 3. Jackie, I want us to start exploring the importance of this collaboration. And I'll ask you, why do you think this collaboration of the OBGYN and the midwives is crucial to ending preventable maternal deaths?
Absolutely. And, Anne, we have been working closely with FIGO for quite some time. And I'm really delighted that we've pulled together on a joint statement on contraception provision. We're working in the space now of guidance, consolidated guidance in relation to PPH. We've worked together before on the critical role of skilled attendants in making pregnancy safer and so on. But in this, so I'm really proud that we have pulled together midwives and obstetricians working together. But in this space, and in response to your question, respectful collaboration is really, really important. And two professions standing side by side, respecting each other, supporting each other, complementary roles and significant roles as midwives and obstetricians. There's evidence on interprofessional collaboration, for example. And we know, and I know that you are a supporter of the midwifery profession, and ICM recognizes the value of how midwives and obstetricians work together. We know that midwives are uniquely positioned to have an impact on recognizing and treating PPH. But just in summary, our collective action, standing side by side, is absolutely vital, because when the critical moment happens, you are looking at the midwife, and the midwife is looking to the obstetrician, and together we can save lives.
I agree with you, Jackie, and I really want to add a few pointers. I belong to a low middle income country, a low resource country, where the majority of frontline providers really are the midwives. And you find there are midwives that do see women in the communities. There are midwives that then link into the health system. But honestly, much as we're emphasizing it all the more today, we have worked hand in hand for the millennial of years, because we must work together. And one thing that's really clear to me is, even in working together with the midwives, what I've constantly noted is you spend much more time than the gynecologist with the patient. So for me, it becomes a no-brainer. Even if we're giving the instructions, the person who's hour to hour with the clients more oftenly is the midwife. And when it looks to the low-risk pregnancies, in majority of the cases, it's the midwife who even conducts that delivery, who conducts the subsequent follow-up in the postnatal period within the hospital and outside of the hospital. I personally belong to the school of thought. The obstetrician and gynecologist really should be given the ammunition to deal with complicated cases. what we would then call the high-risk pregnancies. But more than that, as you have rightfully said, respectful care, working hand in hand, and noting that it should be a team-based approach. I really feel that gives you synergy. It makes our leadership in the maternity units and newborn units much stronger. The quality of care definitely would then even be more enhanced. So I will go and turn myself to really think again. What are the costs to the health system? We don't talk about it often enough, but let's look critically. Affording the obstetrician and gynecologist vis-a-vis the midwife, and particularly now where midwifery has been advanced to specialization and subspecialization, we still find, even if I'm dealing with an MFM specialist, the cost to a health system still makes me think, if we are going to achieve universal health coverage, and with the people of primary health coverage from the lower levels, we can't work without you. We have to work together. So I'll move on and ask you something else. We've had this partnership, and it's really essential to advancing our relationship in preventing maternal and neonatal deaths. But what are we really now doing strategically together as of now?
Absolutely, Anne, and it's so refreshing actually to have this conversation with you and hear your passion for ultimately saving lives and improving outcomes, and the journey and the vehicle to do that, of course, is obstetricians and midwives working hand in hand. And as I mentioned previously, we've worked together on joint statements, we've presented together in webinars, and of course we have some guidance that will really assist in the space of stopping preventable death from PPH going forward. But OBGYNs have a responsibility to collaborate and advocate for an enabling environment for midwives and for midwives to do their work well. So, sometimes an enabling environment is often overlooked and it's kind of wishy-washy. Well, actually, an enabling environment is an environment where midwives feel valued, feel respected, feel invested in. I was saddened. I'm saddened when I speak to some of our midwives, fellow midwives, because we're a family across the globe. And I heard, a midwife saying that because they had no cold store, they were putting a syntocinon ampule in the sand with water and covering it with sand, with the hope that the temperature wouldn't rise too much, and the woman that this person was caring for, that had had 5 previous births with PPH, would not have a 6th. And my heart sunk, because cold store is significant. And but anyway, I don't want to labor the point, but my heart sinks when I think about some of the basic things that countries can invest in, cold store, or indeed heat stable carbetocin, or let's just equip midwives with the infrastructure and the tools to do their jobs well, so that our OBGYNs are dealing with more complex matters.
Thank you, Jackie, for saying this. And I really want to even add on to what you're talking about. We've had the randomized control trials that have been done to actually improve PPH management. You've mentioned heat stable carbetocin as a preventative medication that we do provide, particularly where the cold chain is not monitored. That research was done between obstetricians and gynecologists and midwives, twined together. Then we've also done the other study that looks at tranexamic acid, which deals with treatment of those with PPH. Again, those studies were conducted between midwives and the obstetrician and gynecologist. We've also now had the emotive trial. And the emotive trial, which really gives the care bundle for PPH, was still the obstetrician and gynecologist working in cahoots with the midwife. 60% reduction of PPH, in all honesty. I think we are twinned at the hip. We can't run away from each other, because what has that really done? Unified our development of guidelines and protocol, given us an opportunity to advocate, as you and I are doing this morning, capacity building, both our professional disciplines and continuing on that cascade with mentorship, strengthening of the health system. You've really already alluded to it, that we're really now agitating. That's got to work to really make a difference. And like you and I, we're on the global stage constantly saying we've got to change the environment, value the most important infrastructure in the health system, the human capital. And guess what, Jacqueline? I often ask this question. Who has been endowed with bringing forth new life? It is the midwife and the gynecologist. How much more should we be valued as a professional group? Something that I honestly cannot understand. I honestly feel this group of persons, you and I, and everybody else that we are leading, should really be put at the pinnacle, because we bring forth nations. That's the way I see it.
Wow. I mean, I agree. I absolutely agree. And I couldn't have said it better myself. That needs to be on a world stage somewhere, that statement. And I also think, just standing side by side with you, continuing professional development, because we have a plethora of guidance, evidence, research, kits, and we need to press health system leaders, ministries, governments into recognizing that continuing professional development is an absolute priority. How will our midwives be able to embrace new guidance, utilize the great things that are happening if there is no CPD, continuing professional development? And, we've got the evidence that shows that, yes, the toolkits and the guidance is there, but actually, how do we get it from here to the hands of the clinicians, to the hands of the midwives, and indeed the obstetricians? So CPD is an absolute priority, and in some parts of the world it's an absolute given. But why are we accepting that it's not the same in other parts of the world? Life is life. Let's not get confused or sidelined by the data, because the data obscures the human experience.
Precisely. We're not just a statistic.
No.
The patients we take care of, because I really want us to constantly remember our focus should be the outcome, the satisfaction, and the fact that this is somebody. She's a mother, she's a sister, she's an auntie, she's a cousin. And she's actually just going through a physiological process at the point of delivery. All we do is stand in the gap to make sure it is safe, it's respectfully conducted, it is using evidence-based practices, so that we both end up with a healthy mother and a healthy baby who can contribute to national development. Well, our coffee is getting cold, but even though it is getting cold, I will not leave you without you telling me, what do you see as the vision for ICM and FIGO moving forward?
Yeah, I mean, my vision is that, well, ICM's vision, of course, is that every woman, regardless of socioeconomic status, ethnicity, color of skin, the place where they happen to be pregnant and birthing, has the same maternity outcomes and experiences as those who have the best, and for every woman to have a midwife. But our overriding vision would be that we continue to work collaboratively with FIGO, unifying in our statements, our guidelines, our protocols, advocating and raising awareness, ensuring that we are saying the right things to the right people in the right places, and encouraging, for sure, from our midwives associations, our 139 midwives associations, to be empowered and then skilled to step into that space, because together, I believe we can. You know, separately, a lone voice does not dig deep enough. The stakes are high, and this is about human lives. So, you know, we have a vision where we just want to stop preventable death from postpartum hemorrhage. It's not acceptable. I can't believe, Anne, that we're still talking about it now to this day.
Imagine.
So together we can. Together we can.
Together we can. And I want to believe that if we continue moving from strength to strength with ICM and FIGO, really the championing of this agenda of reduction of maternal and neonatal mortality, it's our prerogative. Yeah. So we need to step up and continue to step up even higher and become really the global health diplomats that speak to the policymakers, the politicians, our co-colleagues, our communities, and individual women and men allies, because I don't want to leave them out, to make sure everybody is engaged. Everybody is engaged. We need to also continuously explore through data, through evidence synthesis, new ways of even doing things and not be myopic in having business usual. Let's change it to business unusual. Put in innovations so that we are actually in the context of the way the world is evolving. And also noting that a lot more women nowadays are having much fewer pregnancies. So how much more should we even be valuing for any woman getting pregnant, that the outcome is just right? I want to end with this, and I want to say this, and this is a quote in one of our African proverbs. A boat does not go forward if each one of us is rowing in your own way. It is by our coming together, being the beginning, keeping together as we are, as progress, and working together, we both will succeed. I want to also end up on a beautiful note, Jacqueline, giving a special and personalized invite to ICM with you in the leadership seat and with your colleagues. You have 139 members. FIGO also has 139 member societies. So you can see we're really twinned. But want to welcome you to the FIGO Congress in October, 5th to 9th in Cape Town. I'm looking forward to your being there so that we can enjoy an academic and also a social program together. But for now, let's have our tea. Let's have a nice cup of tea and something to bite. I'm really happy to be with you. Thank you.
Wow. Well, thank you so much for that very kind invitation. We will absolutely be there, standing side by side with you. I accept this invitation on behalf of ICM's Chief Exec and President, and I'm really looking forward to continuing our chat in the presidential session at Congress. Really looking forward to it, and thank you.
Welcome.
Let's have tea.
Thank you.